Hello guys, welcome back to my channel Religiously Fit. I am so excited to start chapter number 10 of ACE Personal Training Manual edition 5. Chapter is programming and progression. This chapter is going to talk a lot about programming, how to program the exercise plans for your clients and how to do the progressions for them. So without wasting much of your time, let's get started. So first of all, what are the benefits of resistance training? I'll just read out quickly because most of the things are just like definitions. So I don't want to add more content to it. Okay. So the first benefit is physical capacity, ability to perform work or exercise. Like these are all, as I told you earlier as well, these are all my handmade notes. If in case you need my notes, you can directly contact me on Instagram. I live on Instagram with the same name, Religiously Fit. I would be happy to share my notes with you. So, okay, so let's start again. So, what are the benefits? So, after 10 weeks, increase muscle mass of 1.4 kilograms and reduce fat weight by 1.8 kilogram. After how many weeks? 10 weeks. You will gain more muscle, you will lose more weight. Second benefit is physical appearance and body composition. Obviously, you will look much better. Then metabolic function, that it raises your resting metabolic rate. That means you burn more calories while at the rest state. Okay. Now, next one is injury risk and disease prevention. So, increase bone mineral density. Obviously, your bones becomes more strong when you do your resistance training, weight training. Second is decrease risk of osteoporosis and pain of osteoarthritis and rheumatoid. Okay, these are all bone related problems, or you can say diseases. Lower blood pressure, improve lipid profile, decrease risk of metabolic syndrome, decrease depression. These are all advantages of doing resistance training, guys. Okay. Now next one is topic is physiological adaptation to resistance training, that is acute and long term. So what are the factors that influence physiological adaptation to exercise, to resistance training? So those are hormonal levels like of testosterone or growth hormone increase, the sex, age, muscle fiber, is it a type 1, type 2, what kind of muscles are more in your body, muscle length relative to bone, like someone, for example, this is bicep, for someone has a smaller bicep, someone has a longer biceps. So the length of your muscle. And what is your limb length, limb pace, the arms and legs, and the tendon insertion point. Okay, tendon is what is tendon? Which connects bone to the muscle. So, for example, this is my muscle and this is my elbow. So, obviously, this bicep muscle is attached to elbow through a tendon. So, where the tendon is inserted, if you point like this on your biceps, you will be able to, you'll be able to figure out like where the tendon is. It's a soft thing, or you can, in layman language, you can understand it's a soft muscle as compared if you touch your biceps, and if you touch the end point of bicep, you will feel a difference in the flex, the density of that muscle. Okay, so you have to watch a photograph on Google how that tendon looks like, but obviously you don't have to, you can't look at the tendon right from, right as we look through, muscle and all those things. Okay, anyways. So these were the physiological adaptation to resistance training, that the factors which influence someone, someone does good amount of resistance training, then they don't get that much good result, and someone who performs less resistance training, they get fairly better results. So these are the factors like hormone level, sex, age, muscle fiber type, muscle length, limb length, tendon insertion point. Remember this is important. Okay, now going to the next part, which is muscular strength, power, endurance. What is muscular strength, what is muscular power, what is endurance? There's a definition for all those. Muscular strength is like what is the one repetition max, what is the maximum amount of weight that you can pull or push. Endurance is number of repetition, like after how much repetition are you getting fatigue, are you getting tired. So number of repetition that can be performed with a given sub-maximal resistance is endurance. The power is, the definition of power is medium weight with moderate to fast movement speed produces most power. Medium weight with moderate to fast movement produces most power. Okay, so these were three terms along with the definition. Okay, moving to the next topic, which is training variables. What are the variables which, as a trainer, you can change, you can alter, you can move up and down so that your client gets best result. So there are a couple of them. I'll start with the first one, which says needs assessment, health and skill related parameters, which is basically the preliminary round of interview in which you talk to the customer, you ask them questions, to do motivational interviewing. That's the later part, but you ask so many questions to them to understand about their background and genetics and body and exercise history and all those things, all those stories. Okay, it's a story thing. Second is frequency. Like frequency is a training variable which you change so to get different results. So frequency means how many times per week per muscle group. Like biceps, you are training biceps how many times a week. Second is like for beginner, it will be different. For intermediate person, it will be different, and for advanced folk, it will be different. So for beginner, 2 to 3 sessions per week. For intermediate, 3 to 4 sessions per week. Advanced is 4 to 7 sessions per week. Now, next, the first one was need assessment. Second is frequency. Third is exercise selection or the order of exercise. Multi-joint exercise and then single joint exercise. When someone comes into your gym, to your facility, or to you, and they don't have any much background in exercise, they haven't done any workout, they live a sedentary lifestyle, then definitely you are going to tell them that first they need to perform compound movements like multi-joint movements. Like for example, shoulder, that involves this movement. There are multiple joints involved in pushing the shoulder above overhead. So the single joint movement requires much stabilization, like bicep curl, okay, like lunge. So these exercises come later. Fourth thing is volume. Volume is, what is volume? Sets into repetition. How many sets are they going to do, and how many repetitions of that movement they are going to do. So volume is sets into repetition. There might be a question in exam. You have to calculate the volume of a training. Then what is load volume? That was repetition volume, and this is now load volume. Load volume means exercise weight load. How much weight are they going to push into repetition into sets. So in other words, I can say repetition volume, which was sets into repetition, okay, into weight. Sets into repetition into weight gives you load volume. Okay, so volume based on goal. Now there can be like 1, 2, 3, 4, 5 things. Okay, one is general muscular fitness, one is endurance. Like client is coming to you for general fitness, client is coming to you for getting more endurance, strength, power, and hypertrophy, that is muscle size. So based on their criteria, based on their requirement, you are going to suggest like number of sets, reps, and weight. Okay, so there's a table in the ACE book. Like I haven't written the number here, the page number, but I can definitely tell you there's a diagram, or there's a table. Sorry, there's a table which says, like I'll say for you, like couple of them. I'll say it for you. For general fitness, there should be 1 to 2 sets. Repetition should be 8 to 15. And rest should be between 30 seconds to 90 seconds, and intensity, obviously it varies person to person. So when a client is coming to you for general fitness, you are going to prescribe these things as per ACE. If you have certain other criteria coming up from your own gym owner or some other organization, you are feel free to follow that. But because this is an ACE exam, so, and we are talking with respect to the examination. So these are the standards set by ACE. Now, if we talk about the endurance, like they need to build up endurance, then what are you going to say? You are going to prescribe them sets from 2 sets to 3 sets. The repetition should be at least 12, not less than 12. Rest should be less than 30 seconds, not more than it, not like 45 or 60. And the intensity should be between 60 to 70% of 1 rep max. Okay, what is 1 rep max? For example, if your client is doing a bicep curl, and for example, the maximum weight which they can use doing a bicep curl is, for example, 20 kilograms, then, and they can just do a one repetition with that. Like there is a formula behind calculating 1 rep max. I'm right now not going behind that. I'm just trying to make you understand that exactly this topic, specifically this topic. So for example, your client is able to do a bicep curl with 20 kilograms, just one repetition. We are talking about one repetition. So 20 kilograms will be called his or her one rep max. Okay, that is one repetition. The maximum repetition, the maximum weight with one repetition is called one rep max. So when you are training someone for endurance, so the weight should be 60 to 70% of their one rep max. So in our case, 20 kilograms, what is 60% of 20 kilograms? It's 12 kilograms. So between 12 to 60 to 70%, 7 to the 14. So that means from 12 to 14 kilograms, you have to train them for endurance. Okay. Okay, now going to the next topic, which is training principles. So what are the training principles? Like what are the standards with respect to which you will be training your client? So first is double progressive strength training protocol. Double progressive means, sorry guys for my tempo in this video, because this is a very lengthy chapter. So I want to compress as much information in as less time as possible. And also feel free to contact me on Instagram, religiously fit, or YouTube, or maybe Facebook, anywhere. If you have any questions or any feedback, if you want me to make better videos, then please do let me know your kind feedback as well. Okay, so what is double progressive strength training protocol? Is that you will be increasing the repetition and the weight during the exercise. For example, if we are doing again the bicep curl, if we are doing the 4 sets of a bicep curl, for example, so with every set you will be increasing the repetitions, and along with the repetition you will be increasing the weight as well. Okay, so that is called double progressive strength training protocol. Okay, so the second training principle is specificity, appropriate resistance repetition protocol, like resistance and repetition, like with how much resistance and with how much repetitions you will, combination between the resistance and repetition. Short putter versus rower. Okay, so the next is overload. Muscle need to be trained at progressively heavier training loads. Increase load by 5% to facilitate further strength development. This is like we talked about double progressive. This is a single progressive thing where you increase the load by 5%. So right now they are doing with 10 kilograms of dumbbell. So what is the 10 kilogram? What is the 5%? Like okay, we'll take 20 kilograms, because 10 will come to 10.5. So we'll take 20 kilograms. What is 5% of 20 kilograms? Is 1 kilogram. So the next repetition, after finishing one set, next set you will be increasing 1 kilogram. That is 5% of the current weight. Then again 5%. Then again 5%. 5% is a standard thing. Okay. Then fourth thing is reversibility. We lose strength at about 1/2 the rate it was gained. It is just a formula kind of thing. Like you gain whatever rate at which you gain the strength, you lose the strength at half that rate. Okay, that is called reversibility. And the last principle is training principle is diminishing return. When we plateau, you know what is plateau? Like you have been training for a while and now you don't see a growth in your client. No muscle growth, no strength, endurance growth. Okay, so that is called a plateau. When we plateau and need to change the training exercise. Okay, introduce new exercise for new neuromuscular response and motor unit activation pattern for progressive strength gains. What does it mean is that our brain is a very smart fellow. Okay, he knows. Okay, that today's Monday, you are going to train your chest. Okay, you are going to go for a bench press and an incline or decline or those things. So he knows that thing. Okay, your brain knows that thing, that regular pattern. So it is not going to initiate your body. It is not going to make your body ready for the combat. Okay, so you have to train your brain, you have to fool your brain so that the neuromuscular activity is maintained throughout your workouts, and it shouldn't be like diminishing with time. And with that same you are going through that same pattern. So you have to break that pattern, you have to change that exercise routine. Okay, so that the motor unit activation is good so that you see better results in your clients. Okay, now come resistance training periodization models. So what is periodization model? Like you might already be aware of this fact that you train your clients in different types of cycles, like maybe for a week or so, exactly same plan, then maybe for 3 months or 6 months, and maybe more than that. So those are, as per ACE, those are called as periodization cycles. And there are three main cycles, that is macro, meso and micro. So macro cycle is the biggest cycle. Overall time frame for a specific periodization program is typically 6 to 12 months, and you will be following that pattern for 6 to 12 months. That is called macro cycle. Then meso cycle divides macro cycle into few smaller cycles that progressively lead to the ultimate goal. And last one is microcycle, divides mesocycle into smaller and more manageable cycles, normally 2 to 4 weeks in length. So these are 4 cycle, not exactly 4 cycle means 3 cycles means the duration of having that same training program. Okay. So the next is under this resistance training periodization model comes linear periodization, which is consistent training protocols within a training protocol. Change variable after every microcycle. Okay, so linear periodization says that if you are going to make changes into the training variables, okay, so you change those variables after a microcycle. Okay, and what was microcycle? 2 to 4 weeks in length. Undulating periodization is an important thing with respect to exam. It means provides different training protocols during the microcycle in addition to changing the training variables after every microcycle. Guys, I know this might be overwhelming, but try to pause this video and try to listen to the video again and again so that it gets absorbed into your brain. This is these terms might be new to you, and I know I have taken this exam, so sometimes it feels overwhelming. But I am with you. If you have any questions, queries, feedbacks, anything, I am always there for you. So again, I'll say that undulating periodization, it means provides different training protocols during microcycle in addition to changing training variables after every microcycle. So we'll be using different training protocols during microcycles, and after completing that microcycle, we'll changing the training variables again. Okay, now comes first. No, the term is first. First means training variables. F means frequency. I is intensity, then repetition, then sets, then types. FIRST. This means like how many times you will be training your client, what will be the intensity of the workout, or how many repetitions they'll be performing, how many sets, what is the type of exercises. Like 2 to 3 sessions a week, like low intensity, or repetition 10 to 20, or maybe one time a week. So these are these are called training variables. FIRST, very important with respect to exam. Okay. Dependent on client movement efficacy, calibration. Okay, so now first I'll be talking this first: frequency, intensity, resistance, sets, and type with respect to muscular endurance, strength, hypertrophy. Okay, so if we are training a client for muscular endurance, okay, endurance, guys, I'm stressing this word so that you remember this word. So first would be FIRST would be 3 times per week. If one cannot do the same amount of repetitions on second and third workout, then frequency is dropped to 2 times per week. 12 to 16 controlled repetitions and 60 to 70% of 1 RM with rest of 75 to 100 seconds, like minute or 1.5 minute. 2 to 3 sets with less than 60 seconds rest. Emphasize the 5 basic movement patterns with exercise selection. What are 5 basic movement patterns? Pull, push, lunge, squat, and spinal twisting movements. So the basic 5 movements. Okay, so now first for strength, if you're training your client for strength, that is 72 hours between the sessions should be a mandatory thing. It shouldn't be like today you are training for something and next day you are again training for strength. No, 72 hours of break. Then repetition should be between 1 to 6. It depends on the intensity. 1 to 6, the what do you call that? 80 to 90% of 1 RM. 70 to 90% of 1 RM in the initial stages. Then later on you have to increase it till 80 to 90% of 1 RM. Typically 3 to 4 sets, and again emphasis on 5 basic movement patterns. Now first for hypertrophy. Hypertrophy is muscle growth, the size, the increase in the size of muscle. 72 hours of recovery for a muscle group before the next session to train that muscle group. 6 to 12 repetitions at 70 to 80%. Okay, and combination of free weights and machine for equipment. Guys, as I said, this might be overwhelming. So what you can do is you can print out that chart, print out that table from the book and try to memorize these things for a while. And later on, when you will go through this course again and again, maybe you'll revise this, then things will go into your the knowledge. Like your knowledge will build up slowly and slowly. Okay, so don't worry right now with these so many terms and so many things to memorize. It will come up slowly. Okay, just try to listen to the video as many times as possible. That was the approach which I took, and it helped me. Okay, so now there are different types of sets, like you might have heard: supersets, compound sets, breakdown training, assisted training. Supersets is alternating exercises for opposing muscle group between with little rest between the sets, like superset like biceps and triceps is a superset, for example. Just an example. Compound set is two or more exercises for the same muscle in rapid succession, like compound exercise, like I'm doing a bicep curl, then I'm doing a hammer, then I'm doing a concentration. Okay, this is called a compound set for a single same muscle. Then breakdown training is train to fatigue, then reduce the weight by 10-20 and then perform more repetition until failure, which is also called drop set, in which you train yourself to fatigue, yourself or your client to fatigue, to tiredness, and then reduce the weight 10 by or 20% gradually. Assistant training is train to fatigue again, and then have help or manual assistance from a trainer on lifting, on the lifting phase for 3 to 5 posts. Like again, I'm doing a bicep curl, okay, and for what does assisted training means, that right now I'm not able to put this do this concentric movement, so I take a help from a spotter and they'll help me to do this movement, and the eccentric one I have to do on my own. The person has to do on their own. Okay, now coming to improving power, there are certain exercises or certain techniques with which you can increase your power. First is plyometrics. Plyometrics are quick and bursting movements of energy, quick and powerful movements involving stretch, shortening. Like if I say plyometrics, what are plyometrics? These are plyometrics. Okay, these are plyometrics. And the second is stretch, shortening cycle. Active stretch of a muscle followed by an immediate shortening concentric of the same muscle, which is called stretch shortening cycle. Then amortization phase, period of time between eccentric and concentric action. Concentric, hold, eccentric. Okay, that is called amortization phase. Muscle spindles. What is muscle? What are muscle spindles? Sense differences in the rate and magnitude of stretching imposed on a muscle. Muscle spindles are something which are internal to your muscles. Okay, those things, they sense the tension in your muscles and act accordingly to relax or stretch or whatever they have to do to maintain the normalcy in that muscle. Okay, now for older adults, avoid holding breath because of which their BP might increase. Avoid holding isometric contraction because of that BP can increase, blood pressure can increase. 2 sessions per week because their recovery is slow. So these are something which you should avoid. And avoid, whenever the word avoid comes, you have to raise your ears, because avoid is a very, very important thing with respect to ACE exam. If you know right thing or not, that's not that important, but you don't have to train your client so in a way that it harms your client. You never ever have to harm your client. So you always have to ensure that you are training them safe. They are 100% safe. And if you are training an older client or a pregnant lady, you have to be very, very aware of their condition and act accordingly, and you plan their workout plan accordingly. If it is an older adult, you don't have to include much of plyometric exercises because they are very hard on joints and they might injure themselves. Now comes the last part of this chapter, which is nutrition. So there are a few things it tells, like what nutrition they hold, like caffeine enhances athletic performance. Anemia is caused by iron deficiency. Vitamin B12, it increases the metabolism of nerve tissue, protein, fat and carbs. Riboflavin is used for energy production. Vitamin D is used for calcium absorption, bone growth and mineralization, and also good for blood clotting, nerve transmission and muscle stimulation. Remember this you have to memorize, or you have to be good with the biology so that you know these things, but you have to memorize. I think this probably will not be coming in the exams, but it's good as a trainer, you should know this. Steroids. What are steroids? So steroids have side effects, as you might have heard about this. So there are anabolic side effects. What are those? High blood pressure, rage, enlarged breast size, decreased testicle size, increased testosterone, facial hair growth, deepening voice in women. These are some very, very common side effects of steroids, anabolic side effects. Second is androstenedione, which is a precursor to testosterone. Testosterone is also called test. So, what does this androstenedione does to your body? It decreases the HDL level. HDL is a good cholesterol, high density protein, lipoprotein, and increased risk of cardiovascular diseases, prostate cancer, pancreatic cancer, increases baldness as well. So these are some of the disadvantages or side effects of steroids. Okay, with this the chapter got ended. This video was around 25 minutes. I think this video might be helpful for you. Please do let me know so that I can create more value in my videos. And thank you so much for watching. I'll be coming very soon with chapter number 11. Thank you so much guys for watching. Stay healthy, do your workout and be happy. Thank you so much. Bye bye.